And we are live. Good evening. This is United Medical ACO Diabetes Program, Wednesday Wellness Webinar. Today, I'm here with Dr. Barnett-Smith, Amy Wilcoxon, and Donna Gunkel. And my name is Kemal Erkan. I'm the chairman of United Medical ACO. We are going to have another topic to discuss, and we have some questions and answers. And hopefully we can provide some beneficial updates for all of our patients and for those who may not be our patients. So I'm going to quickly introduce our other members of the program. Dr. Ripu Handal, our endocrinologist. He's with First Aid Endo. And Tim McHugh is our physical therapist. I already mentioned Amy. And Wellness Wednesday webinar is part of our diabetes program, and we discuss different topics twice a month. Usually one of those we do the support group, and one of them we have different discussions, and today is one of those. Amy, our dietitian, is one of our panelists, and Dr. Barnett-Smith from United Medical Clinic is with us to be part of our panel. So, Amy.
Thank you, Dr. Barnett. Thank you, Kemal. Thank you, Dr. Barnett-Smith, for coming to talk to us today. So we are going to be talking about plant-based diet and diabetes. So I know both Dr. Barnett-Smith and I get a lot of questions about, well, what is it like to be a plant-based diet? What is it like to be on a plant-based diet or a vegan diet or a vegetarian diet? Because now I have diabetes and I can't eat carbs, since which is a popular misconception that we're going to explore in detail tonight. So with that, Dr. Barnett-Smith, I'll turn it over to you.
If we can, Dr. Barnett-Smith, if you don't mind just briefly introducing yourself. Everyone knows you already, but it would be helpful for those who may not.
Sure. Thank you so much for having me. My name is Rhoneise Barnett-Smith. I am a family practice physician with United Medical Clinic. I work in Bear, Delaware, where I've been now for the last 11 years. And I am excited to be here for several reasons. The topic is very timely. It's something that I get asked almost on a daily basis, and it's something that's near and dear to my heart because about, I want to say 4 years ago now, I transitioned to a plant-based diet myself. So I am very passionate about this subject, so I'm excited to talk about it this evening.
All right, well, thank you.
Okay, so we'll just jump right in. One of the first things that I'm always asked is what exactly a plant-based diet is. And I will be honest, this definition is constantly evolving. If you had asked me this question several years ago, it would have been more steered towards a vegan type diet. But the definition has changed a bit. So the first thing I explain to patients when they ask me about a plant-based diet is that it doesn't mean that you have to be a vegan or a vegetarian. That's a very strict way to look at a plant-based diet, but in looking at how well people are able to adapt to this type of diet, we like to look at things a little bit more broadly. So what you want to do overall is focus on eating more plant foods. So plant foods aren't just fruits and vegetables, but it's also nuts, seeds, whole grains, legumes, and beans. So concentrating on getting more of those foods into your diet is kind of what we consider to be a plant-based diet. So you're focusing on the plants, but you can still have other things in your diet. You can still eat some meats, dairy, and any foods that you want, but you want to focus on those plant foods. The next question I'm inevitably asked is, if I do all this hard work to focus more on plants, what are the benefits? What am I going to get out of it? And why is it something that you're telling me to do? And so increasing plant-based foods, you're going to get more fiber. That's a given. Between your beans and your non-starchy vegetables, you'll have fiber for days. But also from a healthcare standpoint, we see people who adopt a plant-based diet have lower cholesterol. They decrease their risks from some forms of cancers, and they lower their risks of certain diseases like heart disease, diabetes, high blood pressure, and they just decrease their overall mortality by adopting a plant-based lifestyle. And finally, after going through what a plant-based diet is and what the benefits are, people tend to get a little overwhelmed and they want to know, how can I get started? What do I need to do to try and adopt this type of lifestyle? And it may sound really simplistic, but I explain to patients every day, just start with a salad. Have a salad at lunch and dinner, and eat that first, because the non-starchy vegetables are going to give you lots of fiber and it'll make you feel a little bit more full, and you tend to eat less of the other food. You can start to branch out after you get used to doing that, but starting with a salad is a great way to adopt this lifestyle. If you don't like salad, you could do a vegetable soup. There are plenty of other options, but a salad is something that's simple, it's portable, you can take it to work with you. You can usually get it at most restaurants. So it is definitely a great way to get started. Next, I advise people to think about doing something like a Meatless Monday, or doing a full day with no meat or poultry or fish, just vegetarian items. And it will help you get used to having more meals, not just lunch or not just dinner or not just breakfast, that are meatless. And once you do that, it becomes a little bit simpler. You get used to adapting that type of those types of meals into your diet. Also, a lot of people will be concerned about missing certain things. They like barbecue, so they're afraid that if they adopt a more plant-based lifestyle, they won't be able to have their favorite barbecue dish. And this is where you get a chance to be a bit creative, because you can find ways to substitute. You can have, for example, I used to love buffalo wings. And so I adopted a buffalo cauliflower recipe that I have, and actually was a big hit during the Super Bowl. My family ate all my cauliflower when they had their wings, but it's certainly something that gave me the same taste as the chicken wings, but doesn't have any meat in it. And you can do that with all kinds of things. You can do it with veggie burgers. You can do it with tofu. You can do it with vegetables, with legumes, and you can adapt those types of meals that you liked and make them meatless. And then when you have gotten used to that, you can figure out what things you like and what things you don't like, but then you can get some of your favorites and just put them into regular rotation. So if you know that you like a certain type of like burrito bowl or some sort of meal that you thought was really great, just start adding it to your regular rotation of meals that you make. And that is a great way to get this lifestyle started.
All right. I believe, Amy, we have your slides after here. We can, Donna, I don't know if you would like to ask the questions now, or you want to.
Either way, whichever you'd like to do. It might be a little easier right now. So I guess one of the things about getting started, and I really liked your idea about the substitution. So finding like whatever your favorite couple of foods may be, right? And then looking, I mean, Pinterest, the internet, they all have great things. And I know Amy talks to us a lot about putting in what foods you may have in your home and Google it, and it'll tell you different options that you can make. So maybe with those things, have any of your patients given you any information? Like, is it easier for them to get started, or have they found the transition easier when they do certain things of that nature?
I think one of the biggest things is if patients know it doesn't have to be all or nothing. Even just a few small changes can make a huge difference. And generally what I found is that when it's usually finding some substitutions and figuring out ways to get more vegetables into their diet, whether they hide them in sauces or whatever it takes, once they see positive benefits, they want to do more of it. So it's scary in the beginning because, like I said, when you think of plant-based diet, most people automatically think of being a vegetarian or being a vegan and thinking that it's very restrictive. And it certainly can be if that's what you ultimately choose to do or you feel driven to do, but it doesn't have to be in order to get some health benefits from adopting a plant-based lifestyle. Certainly, we want to reduce the amount of meats and poultry if you're going to adopt the lifestyle, but it doesn't have to be completely taken out of your diet. And I think that's what ends up scaring most people. And then once they get used to making some changes, it becomes seamless for them.
Mm-hmm. Or like reducing carbs. So I know sometimes people are like, well, if I take all these other things out, is it going to be hard for me to limit carbs because am I only going to eat vegetables? So I know, like for me, I love pizza. It's like my very favorite food, but sometimes when I feel like I'm eating it too much or I'm trying to be healthier, I've learned how to do zucchini and make little pizzas. So I cut it in the circles and still put a little olive oil on it, put it in the oven to soften it a little, and then take it out and put pizza sauce and cheese, and you can still put toppings on it. And it's healthier than your traditional crust, or you
that
could
actually
use
sounds really delicious. That sounds really good. I may have to try that. I have not tried that. That sounds pretty fantastic. But you're right. And I think one of the other things is just being open to trying new things. I know before I personally transitioned to a plant-based lifestyle, there were so many things I had never tried. I had never tried spaghetti squash. I'd never tried zucchini noodles or even a lot of the lentils and beans that I eat on a regular basis. I just didn't grow up eating those things. And so being open to just trying things that you may have not been exposed to. I'm enjoying Amy's cat. But being open to just try, I mean, it's amazing the things that I found that I just find to be absolutely fantastic that I never would have tried if I hadn't been focusing on trying to get more plants into my diet.
So, Dr. Barnett-Smith, you said that there's a difference between the plant-based versus vegan.
Yeah.
And maybe you already said this, but I do have a little ADHD going on, so maybe I missed that part. What's the biggest difference?
So, okay. So the biggest difference is that being plant-based doesn't necessarily mean that you don't have any animal products in your diet.
Okay.
Someone who is vegan has 0 animal products into their diet. And honestly, I mean, a vegan lifestyle is also about animal products that you wear and use in your makeup and your toothpaste. I mean, just it's more about the protection of animals and animal life as opposed to a health-based lifestyle.
Because you're a physician and you are politically being very correct, and because I'm not a physician, so and then I, as a big animal lover, so I can probably just say some of those. Some studies show that vegan diet actually does hurt animals in a different way because it does take more space from the animal because the consumption of the vegan diet actually is increasing, and then that's taking more stuff from the animals world. So actually, it's like. It's kind of on the extreme side. So we can just say that.
Well, I wouldn't say it's on the extreme side, but I will say that like any sort of belief, there are people on extremes. I would say probably most people aren't, but of course, the people that we see are usually on the extreme because they're the loudest. But what I meant to say, whether or not it's more of a ethical lifestyle as opposed to one focusing just on health, because it does focus a lot, not just on what you eat, but what you wear, the things you put on your body. And so that's a bit different. But if somebody eats strictly plants with absolutely no animal products, I would consider them to be vegan.
Sure, like in the plant-based, someone can just, someone may be eating cheese and drinking
Yes.
Milk, and then still do other stuff on the plant-based. So
absolutely. I mean, if you look at the Mediterranean diet, there's still, low-fat dairy, poultry, fish, but they have a lot of focus on the whole grains, on the legumes, on the non-starchy vegetables, but they still have those other things in their diets as well. And people who follow a Mediterranean diet have, great health benefits, and they still have animal products in their diet. So I don't want to make it seem like you can't have any of those things and enjoy any health benefits, because you can. All I'm saying is that the more plants and the more legumes and the more whole grains that you get in your diet, typically the better you do. And whether that's because you have a healthier weight or that you're not getting inflammation, there's a lot of different ideas on why that is, but typically the more plants you consume, the better health benefits you see.
Sure. And how long have you been doing it now?
4 years. 4 years. Yeah, it's 2022. So
that's good. All right. So, Amy, you want to?
I do have some slides to continue our conversation. So one of the new terms that's used is a plant-forward diet. So to go in with Dr. Barnett-Smith's talk, because it's not just plants. So like Dr. Barnett-Smith was talking about the Mediterranean diet, which if you look at the pyramid, they might eat meat once a month. So they're still having meat, but they're mainly having plant. So plant forward, plant-based, but all foods are included. So I'm going to jump right in with some research with diabetes, because people often hear diabetes, no carbs. I can't have carbs. I can't have grains. And that is not true. So in 2019, the American Diabetes Association met, and they basically rewrote their guidelines for treating diabetes with nutrition. And it came down to its individualized therapy. So people with diabetes should be meeting with registered dietitians for an individual plan. It is no longer one size fits all, and it's no longer just carb counting. I will say, it's on that slide. If a person has type 1 diabetes on intensive insulin therapy, so insulin with breakfast, lunch, and dinner, we are carb counting because we're adjusting meds based on their carbs. But for other people who are not in that category, which is the majority of people with diabetes, we're looking at food. So one of the things that came up in the consensus reports I read in study after study after study is that we're looking at food. We're not looking at carbs, protein, fat. We're looking at actual food, because people think carbs, and Oreo is a carb, but bulgur is also a carb. And one of them is clearly better than another. So if we're solely looking at carb counting, we're not taking out, what is that a really quality carb you're eating? If you're eating something like bulgur, you're getting in carbs, but there's also protein in that carb because it's whole wheat. There's also fiber in that carb. There's niacin, there's B vitamins. So there's a lot of benefits to that. And I combed through a lot of research in preparing for this, because it's something that there's a lot of newer research, a lot of the studies after the 2019, and I have all my papers here, some of my reports on changes that they're seeing, because they have, so there's this, if you could go to my next slide, please. I think I talk about the Adventist health study in my next one. Oh, no, sorry. You could have stayed at the last one. I apologize. So with some of the research, we look to see, well, as Dr. Barnett-Smith said, people with who are on a plant-based diet generally have lower blood pressure, lower rates of diabetes, lower rates of cancer. They live longer, they have less dementia. And then some of it, and they generally tend to be thinner. So their BMI is lower. And so some of the studies looked at to see, well, do they have less risk of all these diseases because they're thinner? So then they actually studied people who were thin, who had a plant-based diet versus non-plant-based diet with diabetes. And there still is an improvement in people where weight is not the issue. So let's dive a little bit into specific nutrition. I also, as some of you listening might know, that I also work at the University of Delaware, and I see students who transition to a plant-based diet, and their parents say to them, go see the nutritionist, because I'm worried you're not eating enough protein. So that's usually the first thing we think of, right? How do you get your protein if you're not eating meat? So protein is an essential nutrient. So, but we talked about it. We don't like to look at it as just protein. We want to see what type of protein, because if I'm eating Spam versus black beans, Spam is probably more protein, but it's a lot of other things in there that are not good for me. Black beans have carbs and protein, but there's a lot of things in there that are really good for me. So you want to make sure every time you eat that there is a protein source there, which could be beans, legumes. It could be some kind of whole wheat, peas, tofu, edamame, nuts. Other whole grains are not included in there. Oats, steel cut oats, rolled oats have protein in them. So a lot of choices out there. Iron, people who are, especially women, on a primarily plant-based diet are at risk for, I should say, younger women are at risk for iron deficiency, as well as young women who eat meat also. So making sure that you're eating foods that are either iron fortified, like a bran cereal, or something like beans, greens, avocado, baked potato, pairing it with vitamin C for better absorption. Zinc is something else. I see a lot of people now with COVID who think they need zinc to ward it off. And so then they think, oh, do I need to eat more meat? I need to eat more oysters. I need to take zinc. No, have some cereal, pumpkin seeds, chickpeas, almond peas. B12 is only found in animal products. So if you are adopting a plant-forward or plant-based diet, like Dr. Barnett-Smith was talking about, and you eat animal products occasionally, you do not have to worry about a B12 deficiency. If you do adopt a very strict vegan diet, after a couple of years, 1 to 2 years, you will need a B12 supplement or use fortified cereal. I do not have fortified milks on there. Almond milk, those milks are usually fortified. Nutritional yeast is another good source. B12 will live in your gut for a couple years. So if you are a vegan mother and have a vegan baby, then your baby needs to be supplemented right away. But otherwise, you have some time. And again, if there are some plants here and there, some animal products here and there, you do not need B12. And then the bottom, again, the key is to always have some kind of protein with it. So you have a wide source of protein. If you are eating mainly plants, you're always having fiber. So we're not looking for fiber because it's there. The average American eats about 10 grams of fiber per day. When we look at people eating a primarily plant-based diet, we see 30, 40, 50, up to 70, which is a lot of fiber, grams of fiber per day. There is a lot of research on hemoglobin A1C with fiber, and more fiber there is, the lower the hemoglobin A1C. So by eating more plants, getting more fiber, bringing down blood sugar. If I could have the next slide, thank you. So here's some of our research. So the Nurses Health Study, Nurses Health Study 2, also there's a lot from the Adventist Health Studies. We do see with highest animal consumption, there's a 13% increased risk of type 2 diabetes. When substituting just 5%, so we're not getting rid of meat, there's a 23% reduced risk of type 2 diabetes. When using and they do use the word vegan, the ADA in their consensus report. So when adopting a vegan diet, there's a 1.23% drop in hemoglobin A1C versus a standard carb controlled, what people are used to carb counting, is only a 0.3% drop. So there is benefit to that. So you may wonder, why? So it's not carbs. Why is that animal protein increasing my risk of type 2 diabetes? And a lot of it has to do with saturated fat, that is animal fat. So saturated fat causes cell death and it increases your insulin resistance. So if I go on a low carb diet and I'm only eating meat, not getting any fiber in there. So again, I'm gone to an extreme. I'm not having some products. I'm not having fruits and vegetables because they're too high in carbs. I am eating a lot of saturated fat. So I'm causing that cell death in my liver, causing insulin resistance, and then leading towards increased risk of diabetes. If I am eating less, so more moderate, I'm eating less animal protein and doing a Meatless Monday, adding in some plant protein, even just 5%, I'm decreasing my risk. So there's research that shows that people who eat 10% of their calories from animal protein versus 100% plant protein, they do have very similar health benefits. So still including that, you're still going to get the same benefits. One of the things that I have been looking for in research and I finally found was comparing the recent surge in vegan junk food that's out there. So I might call myself, and that's really another bad thing. I hate to say bad about, and Dr. Barnett-Smith is nodding her head about the word vegan, is that I could eat Oreos. Yep. I can eat pasta. I can eat potato chips. They're all vegan, but they're not necessarily plants. Well, potato chips originally were a plant. They're descended from plants, but I'm not necessarily healthy. So there was a meta-analysis Harvard did, or Journal of the American Medical Association. I read it from a Harvard study. They did a big meta-analysis. So they looked at over 300,000 people with 25,000 cases of type 2 diabetes, analyzing a plant-based diet and one that was healthier versus one that mainly had more things like sugar, not a lot of plants. So some more of that sort of junk food. And they found that the people, so both groups had lower risks of diabetes, that the people who ate the healthier diet, their inflammation was much lower. So they had less inflammation, less joint pain, less arthritis, lower A1C, better insulin sensitivity, better blood pressure. So you have a benefit by reducing the saturated fat, but then you have an even bigger benefit by increasing the plants. If I could have the next, thank you. So carbs, carbs are really the enemy. Sometimes I miss the 90s or 2000 when fat was the enemy. It's been carbs for a while now. But in study after study after study, people who are eating more carbs, because fiber is carb, are healthier. When we look at what foods decrease risk of dementia, what foods decrease A1C, what foods decrease blood pressure, they're plants across the board. So we want carbs. Now, carbs in a healthy diet with diabetes can be anywhere from 40 to 65%. So 40 is pretty low. And there's some people who do better with a little bit more fat in their diet, ideally healthy fat, avocado. And there's some people who do better with a little bit less fat. Remember, this is individualized nutrition. We all come from different places and we all have different needs. Some people on a plant-based diet are going to feel better with less starch and more non-starchy vegetables. Some people are going to thrive on starch. So everybody's a little bit different. One of the reasons I really advocate for checking your blood sugar is so you know how you respond to foods. Carbohydrates from refined carbohydrate sources. So white bread, crackers, white flour, white sugar, frosted flakes. That's what people think about when we think about carbs, but those are refined carbohydrates. They're made in a factory. We're talking about carbs. They're going to be processed. I don't have oats and beans in my backyard that I can just go out and dig up and dry or do whatever is done to that. I buy them in the store. So they are going to be processed, but they're more minimally processed. They're more related to how they grew. When you're eating that whole carbohydrate, you're getting all the benefits. So when we look at the consensus studies, really the key elements to bring down blood sugar are limited animal products, limited refined grains, as I just talked about, sugars, and then oils too, because a lot of oil will also increase insulin resistance. And it's also going to cause weight gain because oil is 100% fat, even if it's healthy. You can get much better fat from an olive versus eating a lot of olive oil. Not that olive oil is all bad, but a lot of it is not a great thing either. So, and the good, what do we want to put in to really lower your diabetes risk? Is beans. We know that the healthiest population in the world, those blue zones, they all eat beans. So legumes, leafy greens, a lot of research on leafy greens with dementia, with blood pressure, with cancer. So they're a good thing to get in every day. Starchy vegetables, so butternut squash, sweet potato, parsnips, a lot of those root vegetables, turnips that we don't think about, they do have fiber. They're a good choice. Those little purple potatoes. Whole grains like bulgur, quinoa, farro, and fruit. And people think, well, I can't eat bananas because I have diabetes, which is absolutely not true. Should you eat 2 or 3 bananas in one sitting? Probably not, but really none of us should. Well, remember, individualized, somebody out there might need it. But most of us do not, but all fruits fit. Can you eat pineapple? Yes. You might find, oh, pineapple spikes me a little bit, so I should eat it with a meal. Because it spikes me more than something. Grapes are another thing. I had somebody say to me this week, grapes don't really spike me up, but I only eat 15. I said, good for you. And she freezes them so she can eat them more slowly. So we do want to include those carbs because if you're on a plant-based, plant-forward diet, what are plants? Basically, they're carbohydrates. So that goes back to more talking about food versus just talking about nutrients. We don't shop for carbs. We shop for food in the store. And my last slide, I believe my last one, this is just the consensus coming from, this is Diabetes Care, and I believe that should be, I apologize, 2016. So in looking at 22 weeks of a low-fat vegan dietary study, so looking at the carb count, low-fat, reduced calorie meal plan, which is a traditional plan you would get if you went to a hospital diabetes program. Not now, perhaps, when they're more individual, but a traditional program, you would be put on a set amount of carbs that's lower calories, not a lot of fat. So you see A1C drop, weight dropped, LDL, so everything came down. But then you look at a plant-based, using the word vegan, so no carb control. So there was no limit on carbs or calories. There's a higher drop in weight, A1C, cholesterol, and more people were able to stop their diabetes medicine. So to me, that speaks pretty strongly. And I believe that was the end of my slides.
Right. So now at this point, are you both doing the plant-based?
I have been sort of back and forth for years. I've never fully left it. So if we stick with our plant-based, plant-forward definition, yes, I do. For a long time, I was pretty strict. I didn't eat any animal products, but I missed fish and cheese. So, I was born in Maine. I like to eat lobster every year on my birthday. So,
Dr. Barnett-Smith, did you see the movie My Big Fat Greek Wedding?
Yes.
So do you remember the scene where they were trying to feed the guy who's vegetarian? They were trying to feed him lamb.
Yes.
So that actually did happen in my life. So I think it was 4 years ago. I tried to be a vegetarian after watching one of those Netflix
documentaries here.
I apologize for Godzilla over here.
So actually, that's entertaining. So then I was in Turkey after like 7 months of being vegetarian, and then I'm being, being from Turkey and then visiting the family. And then my mom goes, "Oh, don't worry about it. This is just lamb." So,
yeah.
like, Mom, I cannot eat. So it took 10 months. Then I stopped. But it was interesting how people really didn't or understood differently.
Absolutely.
So, but I think the plant-based does offer some flexibility. I think when any of the diets, when they're too strict, it's a turnoff.
Yes.
And now, Don and I, every morning, we do 2 case conferences at 8 in the morning. And when we go through the patient charts with our nurses, one of the things that we see is the actual struggle of keeping them healthy, not just from what they eat, but from everything else that they have to do. And when we put restrictions, when we ban certain things 100%, versus if you are introducing them and if you are being flexible, I think the patient response is much higher. And I do like that better here, which does provide you that type of flexibility. And also, like people do like certain things and they don't want to give up those 100%. Yep. And then they can still be like 75% plant-based. So I think that's a nice advantage that, and I posted some links from the Harvard Medical School with some of the studies. So then I posted on our link, live links. So this is a good alternative. So maybe Donna, you and I, we can maybe try this for the summer.
We can.
Did you know you were trying a new eating plan tonight, Donna?
So the thing is, I've always liked, I've never been a big meat eater. I mean, I do like chicken, I do like fish, but I don't like ham. I'm not particularly keen on steak. I mean, I don't eat a lot of meat to begin with. I mean, I do eat chicken, I do like turkey and fish, and other seafood, but for me, it's not hard because I feel like I could have many meals and not really miss You know what I mean? I'm not one of those people. Although I know, Dr. Barnett-Smith, you were talking earlier about how you grew up.
Mm-hmm.
And so in my family growing up, my mom was raised on a farm. So everything was pretty much meat and potatoes. And my grandmother made homemade yeast rolls every day and homemade, desserts and pies. So, it is kind of what you grow up with, but, sometimes we change when we try things and we realize we really like that. So I do tend to eat more salads in the summer because they're easy, and we chop up a lot of vegetables and kind of create your own salad. So you can have salad several nights in a row, but you can have different toppings on it. So it seems kind of like a different meal. You can have beans on it, or, more fresh vegetables. Kemal and I did the series last year with our gardens. So
grow all those vegetables. So
that's right.
More of those.
Yeah.
So Kemal, another term that's thrown around is
Flexitarian, yeah.
Which means you're sometimes, so there might be days that you don't eat meat, but there might be days that you eat meat.
Yeah.
So it's a little bit different from plant-based because it's not primarily plants. But it is because some people think, well, if you're not eating meat, you must be a vegetarian. I think like you guys were just talking about. And I know when I was stricter and I went to my relatives and my in-laws, they didn't know what to feed me.
Mm-hmm.
We use this. And I don't like to put anybody out.
Yeah.
I don't want to have this feel like they need to prepare a special meal for me.
I had many a Thanksgiving with pasta salad and veggie dip, because there really wasn't much else. My in-laws are from the deep South, and so my mother-in-law, God bless her, frankly told me she can't make a vegetable without some meat in it. So so it's definitely something that is a bit of a learning curve. But one of the things that I say to patients is, people that my plate thing, where you have the plate and you think of the 4 quadrants where you have your protein and your starch and your vegetable and your fat. Well, I tend to tell people an easy way to be more plant forward, as Amy said, is to think of the plate with half of your plate being those non-starchy vegetables. So you make more of your plate, those vegetables, and then have your meat kind of be your side instead of the opposite. A lot of people think of the side salad, you have your salad on the side. Well, make the salad the focus and make your meat be the kind of the side dish or the side on your meal. And I think that's a great way where you can have meat with all of your meals if you wanted to, because you're making it less of the focus. And it's also just a nice way to get people started.
And I like that plate that Kemal just shared, the Harvard. That's the one I've used when teaching, making it, half your plate vegetables. And you might eat a small amount of fruit with the meal, but you might not, depending what it is. I always have fruit and vegetable with lunch. I don't always have fruit with dinner. And then a smaller amount. And I think, I always ask people, I draw the plate and I put it in thirds, and I say, well, not thirds, I do a half and then 2 quarters. And I say, well, what goes where? And when I used to work in pediatrics, the kids would invariably say, meat goes in that big half section. And I would say, well, for most Americans it does, yes, but let's change it around. And I think it is daunting though for some people when I say, fill that up with your broccoli, and they look at me like, I can't eat that much broccoli. I might just eat like 4 pieces and that's it. So they say, well, you could do 2 things. You could do broccoli and a little side salad, or what are you willing to eat? Are you willing to eat some apple slices with your broccoli? So starting with what as Dr. Barnett-Smith said, what you like. I mean, I think, if your mother-in-law's way of cooking beans was with a ham hock, it makes it harder to figure that out. But if she knew veggie dip, then that was a place to start. So, and for some people, starting with, especially with a family, starting with a veggie plate or starting with a bowl of fruit, just to increase those plants. And you talked about the starting with the salad, and there's been a lot of studies on that people eat on average of 100 calories less with their meal when they start with a green salad. I usually specify not Caesar.
Yeah, that's true.
And then also, I think it's a broth-based vegetable soup gives similar results, which would give you more plants to start with, and you get it out of the way. If that's how you feel about vegetables, you need to get them out of the way. One of the things I like to talk to people about with this is to try something new. So starting with what you know, but then go to the store and be like, well, what is that vegetable? I don't know what to do with it. As Donna said, Google it, look it up and see. And then if your family hates it, we tried parsnips because I had the CSA. So it was like mystery vegetables every week. Well, what do I do? This kohlrabi. And nobody liked parsnips. I roasted them. I told everybody they were French fries. They didn't believe me. So we didn't try that. Actually, I think I did try them again because I had more. So we cooked them in a different way. They still didn't pass. So bye-bye parsnips. We moved on to something else.
So, well, this is definitely a good alternative, and again, and probably it's more affordable too. Like if I look at it from different different point, So hopefully this would be another viewpoint for some people, and they can look into it. And I did share some of the links from Harvard directly, and if they would like to dive into that, they can read more. And well, thank you for joining us today. Dr. Barnett-Smith, it's always so much fun to have you on these. You make the conversation a lot more fun. And thank you for being you. And Amy and Donna, thank you for being with me. And these are getting a lot of attention from our patients, and then I know we are able to reach out to so many people. So we'll keep doing this, and thank you for being with us. We'll be back soon. Thank you. Bye-bye.
Good night.